everyone. My name is Alice, and I am one of the affiliate and leadership interns at the Cross Cultural Center this year. And I'll be presenting on the language barriers experienced between the Hispanic community and their healthcare providers. Before we get started, I would like to start off with a land acknowledgement adapted from the UCSD Intertribal Resource Center, and it reads, the UC San Diego community holds great respect for the land and the original people of the area where our campus is located. The university was built on the unceded territory of the Kumeyaay Nation. Today, the Kumeyaay people continue to maintain their political sovereignty and cultural traditions as vital members of the San Diego community. We are honored to share this space with them, and we thank them for their stewardship. Today we'll be discussing language barriers in the healthcare system and going over the consequences, how the Hispanic and Latinx community is affected, the pros and cons of medical interpreters, as well as how we can improve these experiences overall. So first we'll start with the consequences of language barriers and an introduction to the topic. So language barriers lead to a variety of things, including decreased levels of satisfaction for the patient, miscommunication, decreased patient safety, and decreased quality of care. These effects of the language barriers range from access to healthcare to more adverse events taking place for LEP or limited English proficiency patients, to more healthcare services being consumed, as well as less attention has been paid to how the clinicians or the provider's background influences the way that they diagnose disease, and treat the patient, and even less recognition has been given to how the culture of medicine determines interactions or how the culture of healthcare organizations influences what patients understand and how they experience care. Moving on. The main impacts of language barriers are miscommunication, increased healthcare costs, and the application of online translation tools. Miscommunication contributes to a reduction in the satisfaction of both the medical provider and the patient, the quality of the healthcare delivery, and of course, patient safety. Increased healthcare costs can result from more office visits, more follow-ups, unnecessary medical exams or medication, or even having to perform precautionary health measures to identify what exactly it is that the patient has, often without any context or patient history. And the application of online translation tools, which is a positive impact in this case, can help combat language barriers and ease some of the confusion that results from medical appointments. So here are a few statistics to get us started. These are gathered from nurses in Norway and the US. So the first one reads 94.3% of nurses in the US reported that it was very important for their work environment and communication to understand the language of their patients. In Norway, medical providers reported that they had trouble understanding between 36% and 43% of the patients who did not speak the local language, causing them to need interpreters. 37% of these physicians also indicated that they felt patients hid some information because of the language barriers present. Another US study also showed that among patients who received treatment from nurses who didn't speak the local language, 30% had difficulty understanding medical instructions, 30% had a problem with the reliability of the information, and 50% believed that the language barrier present contributed to medical errors made on providers' part. So consequences of language barriers, as shown from this last study in particular, goes both ways, inconveniencing both the provider and the patient. Here are a few more statistics. So other US studies tracking how the patient felt in their medical encounter actually found that among patients who didn't speak the local language, 49% had trouble understanding a medical situation that they were in. Almost 35% were confused about how to use the medication that they were prescribed. And almost 42% had trouble understanding a label on the medication, which, as y'all know, can be very, very dangerous due to allergies or over medication or under medication. Almost 16% had a bad reaction to the medication due to a problem understanding their healthcare provider's instructions. Almost 67% faced a barrier when accessing healthcare, and 20% did not seek health services at all because they were not readily available for fear of not understanding their healthcare provider. Many patients with limited local language proficiency also experienced adverse or dangerous health events. This results this resulted in about 49% of patients having detectable physical harm from their medical encounter with their provider, almost 47% having moderate temporary harm, and about 52% having some type of failure in communication with their medical providers. So patients with limited local language proficiency are much more likely to also miss their medical appointments and have difficulties arranging appointments due to the language barrier. Therefore, these patients have a consistent poor level of satisfaction with their healthcare services, leading to worse health conditions in the long run. Folks with limited English proficiency or LEP, however, are not the only ones who have difficulties with their healthcare providers and understanding the information thrown at them. Medical terminology can be confusing to anyone, which is where the importance of health literacy comes in. Health literacy, according to the National Library of Medicine, is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions for themselves. About 90 million, which is 1 in 9 folks are English speaking, have trouble understanding complex texts common in healthcare. Among those unable to comprehend typical health information were college graduates, professionals such as teachers and engineers, among other folks. And health literacy includes everything, so listening, speaking, and conceptual knowledge about medical content to be able to understand the overall bigger picture. Facilities and healthcare facilities and providers alike must remember that healthcare environments have entire cultures of their own, making it very difficult for anyone to understand the vocabulary used, no matter how educated they might be, unless, of course, they're a doctor themselves. Effective communication between patients and their doctors is a problem, even when language is not a barrier. And physicians need to understand that the health world is like a foreign country to many Americans, and paying closer attention to understanding the language that patients use, as well as how patients draw meaning from what they hear, can improve their health literacy, help them be more confident and comfortable in their medical encounter. So putting medical terms into more culturally appropriate, you could say even user-friendly language, would be a very good start to improving patients' health literacy and their satisfaction, as well as their safety with their experience. So going on to the Hispanic and Latinx community in particular, I would like to show a quick video on how exactly the medical experiences of some limited English proficient patients often go. And this video is from YouTube from a channel called HRQ Patient Safety. And while y'all are watching this video, start thinking about any experiences that you might have had that might have been similar, or maybe a family member or a friend of yours has had a similar experience.
How you say in English, fatiga?
Okay. How long have you been fatigued?
I have fatiga very much. It happened in the morning.
Okay, so you've been tired since this morning. Do you have any other symptoms? Any fevers or chills?
Sorry?
Fevers or chills?
No.
Dizziness?
No.
Bleeding anywhere?
No. Just fatiga.
Did you see your primary care doctor about this?
No.
Okay, thank you. We have a lot of very sick patients tonight, so there may be a bit of a wait, but we will take care of you as soon as we can. Robert Alvin?
Siento como si estuviera molestando a esta gente.
Rafael, por favor.
Debí haberme quedado en casa.
¿Qué te pasa?
Nada.
Mr. Hernandez, what seems to be the trouble today?
I have fatiga. Very much.
Did you just notice this, or has it been going on for a while? When did it start?
It happened in the morning. I feel very bad.
Rachel, I need a Spanish-speaking interpreter, please.
The interpreter's here?
Okay. Can you please ask this patient to describe his symptoms?
Hola, señor. ¿Puede usted, por favor, describir cuáles son sus síntomas?
Tengo mucho fatiga. Me molesta mucho.
He says that he feels very tired or very short of breath. I'm not quite sure.
Which one is it?
Cuando usted dice que tiene fatiga, ¿usted quiere decir que está cansado o que tiene dificultad para respirar?
Me falta el aire cuando respiro.
He means he's short of breath.
Well, that changes things quite a bit. I'm going to ask him some more questions, but let's get him an EKG and an O2 sat. We may need to get him over to the acute area. Mr. Hernandez, your EKG shows that you are having a heart attack. One of the arteries to your heart is blocked.
Señor Hernández, su ecocardiograma muestra que usted está sufriendo un ataque al corazón. Una de las arterias de su corazón está tapada.
You're going to need a procedure called balloon angioplasty to open the artery in your heart.
Usted va a tener que realizar un procedimiento al que llaman angioplastia de globo para abrir la arteria en su corazón.
Do you understand?
¿Entiende usted?
Sí.
Yes.
I'll go over the informed consent forms in a minute, but first I need to make sure you don't have any allergy to IV contrast dye.
Vamos a revisar los formularios de autorización en un momento, pero primero necesito saber si usted es alérgico al el tinte de contraste intravenoso.
No, no creo.
No, I don't think so.
Okay, let's go through the informed consent process and then we'll get you ready for the surgery.
My husband, okay.
Your husband had a very serious heart attack. We didn't know it at first because he didn't have any chest pain.
His heart is still good?
Well, I'm just sorry I didn't understand what he was saying sooner. We're going to do the best that we can.
Mrs. Hernandez, unfortunately, your husband had a very bad allergic reaction to the intravenous contrast that we use for the cardiac catheterization. We were not able to complete the procedure, and he had to be taken to the intensive care unit. He told us he wasn't allergic to the IV contrast, didn't he?
Please, my husband, is okay?
So as y'all can see from the video, there was a variety of problems with the interaction or when some terms couldn't be translated properly by the medical interpreters themselves, and that's with them having knowledge of medical terminology and procedures. And this ended up causing a bad reaction and not allowing the patient to have the surgery that they needed, as well as the attitude and the tone of voice when talking to the patient showed a bit of frustration, which is very common for interactions with limited English proficient patients. So I'd like to hear from y'all now. Have you had a personal experience like this, either yourself, a family member, or friends, or just somebody you know, or maybe something that you've seen online? Y'all can type your experiences in the chat and make sure to set to all panelists and attendees so we can all see your responses. And while y'all are typing, I can go ahead and share an experience that I've had recently with my grandmother. So recently she underwent open heart surgery, and while she was in the hospital recovering, my family and I had to FaceTime her to assist her with the in-person interpreter that was already present, as well as the doctor that didn't speak any Spanish in this case, as well as helping to make her feel comfortable in the hospital while she recovers. Being surrounded by predominantly English-speaking doctors to take a little bit of a toll on her and made her a little bit more hesitant to ask for help or for clarification, whether it be for any procedures or medication that they had to give her after the surgery. So my grandma doesn't speak any English whatsoever. So this experience was super difficult for her as it is, since she's also not entirely familiar with how the healthcare system works. Her lack of health literacy contributed to her feeling uncomfortable, feeling like a burden on the medical interpreter and the doctors during the few days that she was recovering at the hospital. So much like the video, she couldn't really understand some of the terms that the translator was interpreting for her. So Edwina says, my mother had cancer and we did not understand how the procedure would work. Yes, especially with health issues like that are a little bit more serious. It's really important to be able to communicate with your doctor or any interpreters that are present to make sure everything goes as smoothly as possible. And Naomi says, yes, my parents feel like it's often when going to hospitals where no one speaks Spanish. As a medical assistant, I find knowing both English and Spanish extremely helpful when trying to communicate with patients from different backgrounds. Yes, I definitely agree with that. Having volunteered at a clinic myself in Tijuana, this really came in handy. Lauren says, I actually worked as an EMT for 3 years, and these scenarios happened almost every time I took a patient to the emergency room. I would be the only one that knew Spanish, but I couldn't be with the patient the whole time. However, interactions with the nurse and doctor was extremely difficult for them. Yes, definitely. It's hard to, knowing that a patient needs almost your undivided attention to make sure that their encounter goes as safely as possible. But again, you can't spend your entire time with the patient either. Thank you all for your responses. Y'all can continue to type your responses in the chat so we can keep reading them as well. Oh, I'll read one more. From Alyssa, my grandma had cancer and was never given an interpreter, so my aunt had to be with her 24/7. When she was alone, the nurses would ignore her. That is horrible. Oh my goodness. Yes, and this is often the situation that our family members are often put in. Thank you all for sharing again. Go on to the next slide. Here are a bit of facts that I found from studies that I researched. So Latinx folks or Hispanic folks are the largest minority in the US, comprising the majority of the 25 million people in the US with limited English proficiency. Latinx children with LAP parents rather than English proficient parents are less likely to have a medical home or a regular medical provider that they go to, or timely medical care for that matter. They are also more likely to have non-urgent emergency department visits and compromised medication safety, with parents reporting worse communication with providers and a greater dissatisfaction with their healthcare experience overall. Much like all of y'all have already expressed and as we could see from the video. So here are 6 common themes that emerged relevant to healthcare across settings while I was researching. These include the battle of managing language barriers, the preference for bilingual providers, dealing with the negative bias that can be present in interpreted encounters, as we also saw in the video, getting by with limited language skills, fear of being a burden, and the stigma and discrimination that can be experienced by LEP patients. So we'll start with the first one, the battle of managing language barriers. Battle is in quotation marks because lots of participants use the word batalla, which means battle in Spanish. So in several studies for this particular theme, many mothers characterize their healthcare encounters as a batalla. Some mothers use that exact term, while others described similar experiences, but did not apply the exact same language. Most mothers reported a staff member, such as a nurse, frequently served as an interpreter. So not even an official medical interpreter, but a nurse that happened to be bilingual in the facility. They also described battling to bring an interpreter to assist them and difficulties making appointments over the phone or in person. For the preference for a bilingual providers theme, mothers reported having a strong preference for bilingual providers compared to interpreted encounters. They stated that access to bilingual providers eased the communication, improves their understanding, and strengthens the relationship between them and their healthcare provider. Some patients made sacrifices with regard to distance traveled to the clinic or dealing with the long wait times to be seen for their visits just to attend clinics with bilingual providers. As one mother put it, there's nothing like asking in your own language. And as you can see from the infographic on the bottom left of your screen, the US residents who speak a non-English language at home has only been growing exponentially over the years, with the last number given at almost 60 million in 2010. So the negative bias toward interpreted encounters theme. For this one, participants were utilizing an interpreter, and when doing so, they often felt that it made it impersonal and it made the peer encounter take longer. Mothers described feelings of time pressures during their office visits in which an interpreter was used, the lack of interpreter availability or poor experiences with the interpreters that the facility provided led to some mothers actually paying a English-speaking community member to come with them to healthcare visits and translate for them. However, this situation or the solution in this case was often not ideal, as some others reported poor quality interpretations from these community members that came along with them, and of course a significant cost burden from having to pay out of pocket for these folks to accompany them to their medical appointments. So getting by with limited language skills. In addition to difficulties with interpreted encounters, mothers also frequently describe situations of providers getting by on limited language skills. However, they did not always identify it as problematic. So for example, one mother recounted, "No, I may not understand her too well. She can't speak Spanish too well. She tries to explain, and if you understand her, then fine. And if not, I don't see anything wrong with her. I mean, she's fine." So the mother saying that it's almost excusing or almost putting the blame on herself for not understanding the provider rather than thinking that they should be better accommodating her as a patient. One participant also cited an experience where a doctor would get so nervous that she would speak to me in Italian, and I didn't want to make her feel bad because she was very nice. Another mother also stated that getting by could lead to misunderstanding about medications. So in one case, a specialty care physician described an especially problematic situation when suboptimal communication had resulted in a lack of knowledge about the surgical procedure to be performed, and it was only clarified on the day of surgery. And in general, for this study, participants expressed willingness to accept providers getting by with their limited language skills because of the lack of access to certified interpreters and bilingual providers. So in this case, participants felt like they had to settle, but often they wouldn't express any problems with it because of the feeling of not wanting to be a burden to the providers or the facility as a whole. Which takes us to our next theme, fear of being a burden. So participants also frequently described getting by for fears of being a burden or being singled out because of their language need. As we could also see in the video that we just watched, it did feel like the patient was being singled out because they had to call for a medical interpreter out loud. So for this theme, one mother stated, "I understand a little, but not that much, but I don't want to cause any trouble," which is not a thought that patients should be having when going to get help at these healthcare facilities with providers that they believe should understand them, should be able to understand them. So common across many mothers were reports of not asking for clarification or bringing up questions due to the perception that it was burdensome. Mothers expressed concerns about asking questions since they already felt that they had burdened the providers with their language need as it was. That made communication more difficult for the required the services of an interpreter. The final theme that I researched was the stigma and discrimination experienced by limited English proficiency families. So in this case, mothers also described several instances of humiliation and discrimination due to their language barriers. One mother stated, "Honestly, I sort of have seen that there's a lot of racism at the hospitals. Sometimes they don't want to understand you simply because you are Hispanic." She goes on to say, another mother stated, "They humiliate you. I feel like they discriminate because they speak English." And I have actually experienced this with family members that I used to go with when I was younger to also be able to translate to. They feel very uncomfortable from the people at the front desk, for example, because of the tone of voice or maybe a look that they're given. And their body language, of course, says a lot about how they feel about the patient, and the patient can internalize all of this. So now we're going to be diving a little bit deeper into the pros and cons of having a medical provider, as well as improvised medical providers such as family members or friends. So what many may not know is that there is a bit of legality behind this issue of language barriers in the healthcare system. So in 1964, the passing of the U.S. Civil Rights Act helped ensure that a lack of English language skills wouldn't be a source of discrimination. U.S. law also requires that healthcare organizations provide interpreter services to patients with limited English proficiency, and regulations implemented as part of the Affordable Care Act also place new restrictions on the use of family members as interpreters and validating the language skills of healthcare workers. So many limited English proficiency patients don't realize that they have this right legally to request a medical interpreter, leaving this resource unutilized by most patients, either because they are not aware that they have this right or because they are still too uncomfortable or embarrassed to ask for this resource for fear of being burdensome. So there are a bit of positive aspects to having a medical interpreter present. So they can serve as cultural brokers to ensure that what a nurse says or what a healthcare provider says is delivered with technical accuracy and culturally specific phrasing. Nurses can also assess the quality of medical interpreters, cultural brokerage, as well as assist with navigating online technologies such as Google Translate and Medibabble to empower patients and have them play a direct role in their healthcare experience. However, to become a medical interpreter, there is currently no minimum number of course hours required for interpreter training. It is only recommended that programs adhere to its curriculum standards, which was developed in 2011. So implementing a course that meets the standards required requires a minimum of 40 hours of study and successful live demonstration of their language skills. Participants receive a certificate after they've completed the 40 hours of that course, and they can then go on to take a national exam to become a board certified medical interpreter. However, certification is also voluntary. So just like there is issues with, or just like there are positive aspects to having a medical interpreter present, issues can also arise from having them there. So limited or misdirected hospital budgets might even prevent hiring of more interpreters to begin with. Even with speaking through an interpreter, it is often not as effective or satisfying as having a direct conversation with a healthcare provider. These limitations can hinder patients from becoming an active participant in their own healthcare and forcing them into a more passive role when it comes to their well-being because they're not communicating directly with their provider and have to have a third party there. Patients and healthcare workers have also reported a disconnect because neither side was certain that their interactions were being interpreted appropriately by the medical interpreter. Additionally, the formation of a trusting relationship between the physician and the patient is impeded, making follow-up care very difficult for the patient and only making the patient more hesitant to ask for clarification even after the interpreter has translated or asking for any help that they may need. So on to improvised medical interpreters. And the technical term for this is ad hoc interpreters. So these would count as patients' family members or friends, which are often used still. And in utilizing these folks, it increases the risk that something won't be translated correctly because, again, they may not be completely aware or familiar with the medical terminology. So in doing this, it is only brewing error. These family members may also not feel comfortable conveying some sensitive types of information to the patient, such as about sexual health, substance abuse, or even a terminal diagnosis. And this all increases the risk of medical errors, and it might even violate patient confidentiality protocols that healthcare facilities are required to follow. The Robert Wood Johnson Foundation, or RWJF, report found that patients who lean on family and friends as interpreters rather than a medical interpreter themselves tend to actually lose trust in their healthcare providers. So family members usually do not have a full understanding of the healthcare industry terminology, which can also leave some concepts lost in translation. And this lack of familiarity with safety risks associated with medications may also cause a severe safety hazard and impact the quality of care by misinterpreting important information, whether that be about medication, diagnosis, any procedures that may have to be done, follow-ups, anything of that nature. So here are a bit of statistics on the limited English proficiency community in the US. 8% out of 52 million Medicare beneficiaries have LEP, and these results are from 2017. 21% of the US population does not have a high English proficiency per 2013 data from the United States Census Bureau. And 9% of the US population is at risk for an adverse patient safety event or a dangerous safety event as a result of a language discrepancy, according to a 2012 report from the AHRQ. The Robert Wood Johnson Foundation also reports that half of Spanish-speaking patients perceive language limitations as their biggest barrier to healthcare. To help visualize California's position in all of this, here's an infographic on the top states in the country with the highest prevalence of Medicare beneficiaries who are limited English proficient. As you can see, California is the top state with 22% of the population being part of the LEP community, compared to a national average of only 7.7%. Hawaii is not too far behind us at 19%, followed by New York at 16%. Here's another infographic showing that in the US, Spanish is the most common non-English language spoken by Medicare beneficiaries with limited English proficiency, coming in at 52%, which is about 2.1 million. The next biggest percentage is languages in the other category, which is almost at 1 million. And the languages such as Chinese and Vietnamese come in at only 5% and 4% respectively. Now let's get into a bit of the implicit bias that is often present in medical encounters between LEP patients and their healthcare providers. So LEP patients may be reluctant to ask for info because, of course, they don't want to be a burden. Immigrant patients, for example, may experience many barriers when accessing healthcare, not only language differences, but cultural differences as well. Clinicians often drop core relationship building elements from their patient interactions, to take on a more restricting approach to patient care. Providers can also be more directive with immigrant patients and deliberately withhold information based on the belief that immigrant patients will have limited understanding. Although there will probably be limited understanding on their part, there is no reason to withhold any patient information, as this can cause a severe safety hazard. Interpreters may also have the same implicit bias as they intentionally or unintentionally add or subtract things that they might think the patient needs to know or not need to know. And they may have attitudes and values that differ from the physicians or patients. They may also have a different knowledge base or understanding of the context of the medical appointment. It's sometimes hard to tell if the interpreters understand any nonverbal cues of the patient, making it difficult for them to effectively contribute to the conversation. And family members may also have this implicit bias as they feel the need to guard the patient's feelings or protect them from bad news. Studies show that LEP patients are less likely to contain consent forms in their charts from English compared to English-speaking patients. And despite all of this, LEP patients may still look for compassion from their providers using body language and nonverbal cues that may or may not be picked up on. I meant to switch to this slide when I was saying that. Other than implicit bias and other struggles that may arise, LEP patients are more likely to experience physical harm as a result of their medical encounter. So according to a study in 2007, a little bit over 49% of LEP patients received some kind of physical harm as a result of a medical error, compared to only 29.5% of English-speaking patients. For example, in 2018, a patient in California underwent a nephrectomy in which the healthy kidney was removed instead of the diseased one. And it was later discovered that the patient was of limited English proficiency and actually signed a consent form in English and was not provided an interpreter or discharge instructions in Spanish. Medical errors are prevalent due to the inappropriate use or disregard of interpreting services that healthcare facilities and providers have with their patients. Additionally, patients may find it hard to rate their pain because of their limited English proficiency. Pain and distress can be described in different ways by different cultural groups, and it's also subjective. So one can't assume what somebody's pain tolerance is or how much pain you think they are experiencing. These inaccurate pain ratings can lead to over-medication, under-medication, unnecessary procedures, among other things. Psychological distress can also result from being unable to understand treatment plans, which in the long run leads to decreased health outcomes for patients. Let's go over a bit of demographics. In the US, a language other than English is spoken in 1 in 5 households, the highest level since just after World War I. The largest group of migrants in the last 30 years speak Spanish, yet only 5% of US nurses identify as Hispanic or Latino. Nearly 6 in 10 Hispanic adults have had a difficult time communicating with a healthcare provider because of a language or cultural barrier, often turning to outside sources for help. And more than 1 in 4 Hispanic adults look to a translator, public resources in their community, or online sources for help. According to a survey by ARP, more than half of the participants would say that it would be easy for older Latinx folks in the area to find a nursing home or assisted living facility with staff that speaks their language, or even to find a home health aide who does. Less than 3 in 10 say the same about finding long-term care providers who can prepare the kind of food that they are used to. And some also have concerns about finding nursing homes and assisted living facilities that will respect their religious or spiritual beliefs. So here is a real life example of exactly that, a patient struggling with LEP in a healthcare setting. So I'm going to read this out loud. Antonio Torres, 53, of Orlando, Florida, who is bilingual and legally blind, says that he regularly struggles to understand the medical terms used by doctors and nurses. He quotes that when I tell them I don't understand, they'll bring someone over to speak to me in Spanish and I don't understand them either. He is Puerto Rican and was raised in New York. He states, "We didn't grow up speaking that formal Spanish, so I have no idea what they're saying." At times, Mr. Torres said that he even gets medicine with his name spelled on the bottle, and he states, "And I don't know if I'm taking my medicine or someone else's." He also says that he is not confident that he'll find a culturally sensitive nursing home when he gets older. He states that, "I'd rather just live alone and poison myself by accident rather than stay in one of those homes right now." So as you can see, especially older Hispanic or Latinx folks may have all of these sentiments, especially if they feel like they don't have anybody to turn to when they have questions or concerns, like he brought up throughout his interview. And now going on to some of the solutions that we can do, as well as what the healthcare system can do. And before moving on to possible solutions and ways to improve LEP patients' experience, I'd like to also hear from y'all. So how do y'all think that healthcare facilities can make LEP patients' experience more comfortable, more efficient, more accurate, and overall safer, so we don't have any instances like Mr. Torres that we just read? Y'all can also type your ideas in the chat, and again, make sure to set it to all panelists and attendees so we can all read your ideas. When answering this question, y'all can also think about your personal or family members' experience and how you think they could have been made to feel more comfortable, or any process that would have made things more efficient, that would have lessened the hesitancy to ask for clarification on medication, any procedures, or the overall process of going into your appointment, or even discharge instructions, anything of that nature. And we have Violetta saying infographics and physical pamphlets in various languages based on common health conditions that can be used if that's all that is available. Yes, definitely agree. Fatima says increase funding for qualified interpreters and implement different models to increasing linguistic accessibility, like pictures and different graphics. Yes, I definitely agree. The visual aspects of your healthcare encounter definitely helps. Violetta also says that basic training on words in different languages. Sometimes words sound like other words in different languages but mean different things. Quick and easy guide. That is Definitely true. Anna says, I think prioritizing Spanish lessons K through 12 would lead to an increase in compassion and understanding, and hopefully less issues such as these, since it would be easier to take a short medical Spanish refresher than learn it from the start. It's frustrating that we only require 2 years, and even then, it's super late in life. Definitely agree with that as well. Thank you all for your ideas. We'll cover them a little bit more in depth in the next few slides. So before moving on to possible solutions, let me pause this. I would like to show a quick video.
Mobile health clinics
From the KTVB channel.
residents.
We see about 70% that are uninsured, and the few that do come in with insurance, just because of the deductibles and the high co-pays and things, are not accessing and utilizing their insurance very well.
Maria Lee is the mobile clinic coordinator for St. Alphonsus. She has been driving this van around Canyon County now for 3 years, unloading supplies and equipment into places like this, a food box distribution location in Caldwell.
We have blood pressures, we're doing blood sugars, we're doing free flu shots, we have ear washing.
There's also dental, vision, and cancer screenings at some clinics. When someone shows up speaking a language unknown to the healthcare providers, Lee says this has been a wonderful tool.
Hola, yo soy América, yo voy a ser su intérprete. ¿Sí me escucha usted?
Hola, sí, yo soy Francisca.
Buenas tardes, señora Francisca.
The Video Remote Interpreting System, or VRI, connects the nurse or doctor with a person at a regional call center who knows the patient's language.
And I'd just like to ask her how she's feeling today.
¿Cómo se siente usted hoy?
Muy bien.
So what this does is provide an in-person interpreter over an encrypted and secure video feed so that you have real-time interpreting at the touch of a screen.
Tony Fisk is the Community Services Manager at St. Alphonsus. He explains how easy it works.
Basically, there is a touch screen with some icons for the available languages. You can select whether you want a male or a female interpreter, and you simply touch that button and wait for somebody to come online or for an operator to help you.
He says it takes about 2 minutes to connect and speeds up the care of patients at these clinics where there are no appointments.
Have you ever had a flu shot before?
Soy una de las enfermeras.
Spanish has been used most often, but Lee says it's certainly not the only one. There are 200 at their fingertips, including sign language.
Our focus has been the Spanish speakers, but I've had a woman from Mongolia come in speaking Russian.
With VRI technology, the language barrier is no problem, and Lee says they imagine it will only be used more and more across our community.
This tool is just a beautiful example of how we can reach out and touch the patient in their own native tongue, and we can help them to feel comfortable and welcomed and cared for, because we can communicate easily with them through this interpretive tablet.
In Canyon County, Tammy Tremblay.
That's it, you're all finished, Jane. Muchas gracias. Thank you.
Thanks a lot.
Idaho's News Channel 7.
From Idaho, and it is a mobile clinic that comes to rural areas that may not have easy access to healthcare facilities as it is. And I really thought that that was an amazing effort on their part. Not only did it make it efficient, but it made the patient feel much more comfortable. So there are several ways that we can improve LAP patients' healthcare experiences. Perhaps the easiest and most immediate method would be something much like the video, where we can provide services such as Google Translate and Medibabble in hospitals, which has actually previously increased the satisfaction of both the medical providers and patients to 92%, as well as improve the quality of healthcare delivery and patient safety. Providing interpreter services can also lead to more targeted healthcare, concentrating higher healthcare utilization into a smaller number of visits. So less hospitalization, better chronic disease outcomes in the long run, and lower healthcare costs. They can also improve patient engagement, reduce medical errors, and facilitate efficient communication between patient and provider. Facilities can also hire professional staff members or healthcare providers who speak other languages fluently, are certified for their skills, and they can also help them obtain medical interpreter training to make it official. Hospitals can even develop an agreement for the patient care unit so that the nurses with other than English language skills, with their permission of course, can be assigned to language matching patients. As interpreters are used, healthcare settings must also document the use of these medical interpreter services. This means that timing the interpreter use strategically. So for example, during admission, during the patient teaching, so during their appointment, and at patient discharge. Having discharge instructions and patient education materials in many languages can also help prioritize patient understanding of medication management and aftercare instructions. More visuals and infographics, as y'all had mentioned earlier, can also be made to contribute to the patient's understanding of the information that they're getting from their healthcare provider. Clinicians' ability to explain, listen, and empathize can also improve their experiences. So using a combination of the right people and translation technology, along with, of course, partnering with the actual families and communities to address the management of language barriers, is needed to improve healthcare quality and the safety of patients as well as their families. It's important to have the community and patients involved in the solution, as they're the ones that are directly affected. And not only would it benefit the patient themselves, but it also has social health and business benefits for the facilities in them becoming a culturally competent healthcare organization. They can also win in the situation. So to name a few on your screen, it will increase trust, promote inclusion of community members, increase preventative care by patients, decrease barriers that slow progress, improve efficiency of the care, among several other benefits. And that concludes my presentation for tonight. Here is a QR code and a tiny URL if you'd like to look through all of the resources that I used. It'll take you to a Google Doc with all of those links. And thank you all for attending and participating. Make sure y'all follow the Cross Cultural Center on all of our social media, which will be on the next slide. And also make sure to scan this QR code or follow the tiny URL on your screen to be entered for a chance in an opportunity drawing. And the name of the program is Language Barriers, Hispanic Community versus Healthcare Providers. And of course, make sure to follow our social media. Check out our YouTube channel that will have all of these recordings uploaded on there in case you missed anything or want to go back to the survey or any of the videos that I showed. You can also scan this QR code on your screen that will take you directly to our Linktree, where you can find all of this info and direct links to our social media. And if you'd like, you can also contact us, cccenter@ucsd.edu.